So welcome everyone. This is an interview of Professor Beate Kampmann, who was one of the presenters on the Vaccines Are Coming session in European Health Forum Gastein 2020 session. And my name is Suvi Karuranga. I'm one of the Young Forum Gasteiners in 2020, and I'm going to give floor for Beate Kampmann to present herself.
Hello, well, thanks very much, Suvi, for inviting me to do this interview. I am the director of the Vaccine Centre at the London School of Hygiene and Tropical Medicine in the UK, and I also work as the leader for vaccine research at the MRC unit in the Gambia. So I have a mixed perspective on things from a high and a low income country setting, and I'm a pediatric infectious diseases specialist by training.
Pleasure to have you. Thank you so much for your time. My first question for you would be, can this pandemic be interpreted as a game changer in terms of an improved collaboration between the public and private sector? Can it be maintained in the long term?
Yeah, I think we all agree that we've seen unprecedented speed in the development of the vaccine candidates, and this has clearly been coming together of academia, pharmacy industry, regulatory stakeholders, and also funders. And I think there is a precedent set here, and it will be very difficult to say no to similar developments in the next pandemic, which hopefully we won't have.
Yeah. My second question is, what were the top 3 biggest challenges of the COVID vaccine development so far?
So I think the first main challenge is that COVID-19 or SARS-CoV-2 is a really new disease. So our insights into what a protective immune response should look like are very, very limited, even at this stage. We think it's antibody mediated, but also T-cell mediated, but the exact details are still, being investigated. And we don't have to date a correlate of protection. So to develop vaccines in the absence of a correlate of protection is always a massive challenge. The second challenge, I think, is, we have used a whole lot of new, what we call plug and play technologies. For example, the development of the mRNA vaccines, various vectors, which haven't yet been licensed in vaccines before. So there's a challenge for regulators to really think about the dossier they need to see from investigators that will facilitate the licensing of the vaccine. And I think the third challenge is probably to manage the expectations that are now connected to the vaccines, which everybody seems to think they're going to be the magic silver bullet. And I think we need to start a dialogue in a bit more depth to actually critically appraise what the vaccines will be able to do and what they can't. And we don't yet have all the knowledge. So we're kind of operating in a best guess scenario. And we, on the other hand, have to be frightfully reassuring because people want to see a way out of the pandemic.
Yes, there is indeed a lot unknown currently, but is it possible to already be giving an estimate how much will a coronavirus vaccine cost?
So I believe personally that there'll be more than one vaccine, and the world needs more than one vaccine because it's going to be very difficult to satisfy the global demand with just one particular vaccine. Given the fact that the vaccine production is very much driven by industry now, we don't have a good handle on the projected costs, although some discussions around, the target product profile and the costings have been had. Now, it is likely that the vaccine will cost more money in high-income countries than it will cost in low-income countries. And the COVAX initiative, the accelerator for access to vaccines, is very actively working also with Gavi to get advanced market agreements so that the cost of the vaccines will be affordable, even for countries who have less income.
How about, is it possible to give an estimate how long is it going to take for the whole world to have access to COVID vaccine?
So this is the million-dollar question. The first thing we have to have is a safe and effective vaccine. And when we have that, then we can really speculate about the timeline, although many thoughts are going into this right now. And, even thinking about the manufacturing capabilities worldwide, and COVAX initiative and CEPI have done a mapping exercise around this. And they think in the best case scenario, we can make 2 billion doses of a vaccine by the end of 2021. And that is still only going to cover about 20% of the population worldwide that is at risk. But that might be, a really important first step to alleviate any severe consequences from COVID-19.
So in the current situation, what would you say? Are we closer to the beginning or to the end of the pandemic?
I wish I had a crystal ball, because we are currently experiencing in the UK a really massive second wave. I think for countries who have put in place very stringent test and trace procedures, they are probably in a better situation than countries where this hasn't been the case. I think we are somewhere in the middle. I don't think we're right at the beginning, we're learning, but also I don't think we're anywhere near the end. I think this virus will live with us for quite some time, even if we have and when we have a vaccine.
Thank you very much for this interview, and we look forward to see what is going to happen with the COVID vaccines.
Yes, thank you very much.